Thank you for joining us for Ask a Therapist, the Blue Cross Blue Shield of South Carolina series in which we speak with mental health professionals about issues many people face every day. I'm one of your hosts, Ryle Curtis, and today we're joined by Dr. Brian Fox, a licensed therapist, to talk about how to get started with professional care for mental health. Dr. Fox, thank you for joining us today.
Great to be here. Great to be here.
Let's jump right in. So, our first question is why is it important to take care of our mental health?
Well, gosh, there are a lot of reasons, but I think, particularly when we think about mental health, oftentimes we try to separate it, but really mental health and physical health are just health. And so if we're neglecting one or the other, they tend to affect each other. So attending to your mental health is as important as attending to your physical health in many ways. So it's really important for overall health and wellness, whether you have physical concerns or a mental health issue already, it's really important to take some of those preventive measures as well, just like we do with our physical health. Practicing good mental health habits is just as important.
What is a common misconception or maybe common myth about mental health care?
I think, there's a lot of mystery around mental health and what exactly happens when you go to a mental health provider and they're going to make you tell your deepest, darkest secrets or things like that. And I think that's one of those big myths that there's somehow some magic manipulation happening perhaps or something like that, when in reality all we're trying to do as mental health practitioners is kind of walk alongside you and help you kind of come to terms with your own understanding of your mental health. I like to use the analogy of kind of like most mental health providers are kind of like tour guides, and we're gonna ride along with you, and we're gonna point out some sites that you might wanna go check out and look at because we feel like that might be really important for you to gain some understanding or gain an insight into kinda how your particular mental health or way of looking at things or your perceptions might impact that. But if you choose not to go look at that, there's nothing that we're going to do that's gonna force you to do that. It's really just a real cooperative process to try to help somebody kind of untangle some things that may have been causing them some difficulty, help them learn more effective ways to deal with whatever's happening so that they can kind of engage back in their life in a more enjoyable way. That's really all it is. And I think sometimes there is some misconceptions because we see things in the media, we see things on movies that makes it feel like there's, something really more significant to it, and that's probably the biggest myth out there.
I really like that tour guide analogy. You talk about someone that might be struggling, having a difficult time. How does someone know when they might need help with mental health? What are some of those things to be looking for?
Yeah, this can sometimes be a little difficult for folks because, we all have struggles, we all have difficulties, we all get sad at times, things like that. Whenever you're talking about whether or not it's time to go take that next step, it really comes down to, is this issue impacting your daily routine? Is it something that's consuming a lot of your energy, thoughts, things like that? Are you noticing that certain patterns have continued to play out over time that are not getting you kind of the reactions, or you're not getting the things out of life that you'd really like to have? Um, Sometimes it's really obvious. There can be big events. You deal with a traumatic event, and then that makes it pretty clear that maybe I need to go see somebody about that. But really, over time there can be sort of patterns that build up based on different you know mental health issues or things that maybe you just kind of develop over time. And so it's really just as simple as, is it causing you some stress? Is it something that you feel like, this is not getting me where I want to be? Then it's probably time to at least talk to somebody about it. It may turn out to be something that can be very easily dealt with, or may not be something that a mental health provider feels like is really at the level of needing, significant intervention. but it's always good to check it out.
And to that point about seeking professional help, what are the different types of mental health care professionals that someone might consider, and how do you go about deciding what type of care you might need?
Yeah, I think this can be a really difficult part of this process because it is kind of confusing. There are a lot of different providers out there that have kind of specific areas of expertise and skill sets, and knowing what those are can sometimes be a challenge. So at the very top, if we want to think about those with kind of like the most training and experience, we've got psychiatrists. Those are medical doctors who have gone to medical school, and while a lot of psychiatrists will do therapy, a lot of them are also more into, dealing with the diagnostic side and medication management. They're the ones who can prescribe medicines. So, should you be at a place where you feel, or someone else you've talked to feels like medications are necessary, the psychiatrist is the route to go. Stepping down from that is the psychologist, and those two, the psychiatrist and the psychologist, oftentimes get confused. A psychologist, it has a PhD. They have significant amounts of training, but they don't prescribe medications. So the psychologist is going to be concerned primarily with doing therapy or doing testing. And so if somebody has suggested, hey, we're not really sure what's going on, we'd like to do some psychological testing to kind of get a better understanding of maybe some of the underlying things that we can't quite tease out, then the psychologist would be the route that they would refer you to. And that's the person who would give you the battery of tests and do that interpretation. Now you take a step down from that and you've got your therapist, and therapists come in a couple of different varieties. So this is also where it gets a little confusing. So there are various credentials that therapists can get, but they all tend to kind of revolve around the idea of these are the folks who are going to do the primary talk therapy with anybody who is seeking counseling. And so you've got licensed professional counselors, or LPCs. You can also have licensed independent social workers. That is a licensure that is unique to certain states, but basically a licensed independent social worker or a licensed clinical social worker are going to be those folks who have specific training to provide therapy in kind of a private practice setting, like a licensed professional counselor. You may also see licensed marriage and family counselors. Those are folks that kind of specialize in marriage or family therapy. The thing that gets confusing is not knowing which of those folks you have to see or where to start.
So to that point, how would someone decide between seeing a counselor or seeing a doctor? And are there cases that common for people to see both a counselor and a doctor?
Yeah, I think it is common for people to have a therapist who's doing the talk therapy with them and seeing a psychiatrist who may be prescribing medications to supplement treatment that you're getting. So that is not uncommon. And in fact, that's probably the more common way that folks engage in mental health treatment. And it's really what I would always caution anybody about is using medications without the therapy is often not the preferred way to go about treatment. In fact, it probably isn't going to be as effective. Medications can address certain physiological and biological processes that may alleviate certain symptoms, but it's the therapy that builds the skills and kind of untangles some of the underlying things that may still be there even if you're taking medications. So it is very common that we use both together. And in fact, if you're on medications, I strongly recommend to anybody that they also be working with a therapist. 9 times out of 10, as we tackle the first part of that question, 9 times out of 10, the starting point for somebody is really with that counselor. And so seeking out a licensed professional counselor or a licensed independent social worker, somebody like that, who can kind of get you in do a little more in-depth evaluation, they're going to be very, very capable of letting you know if and when it's time to engage with a psychiatrist. They may tell you right off the bat, the symptoms you're experiencing, we need to go ahead and get you in with a psychiatrist. But oftentimes you can start that therapy process and it can be very, very effective, and you may never need to go the route of the psychiatrist. I generally would recommend that anybody who's contemplating looking into some type of treatment for their mental health, the therapist route, that licensed professional counselor, licensed independent social worker, that route, that's generally the best place to start.
If you've taken that step to get started, where do you start? How can someone get started with finding care for mental health?
I think we're probably getting better at having various resources that help people to find those types of services. But again, because of the complexity of the different types of providers and what they do, it can sometimes be a daunting task. One of the best ways, particularly for our Blue Cross members, we can use the My Health Toolkit. In there, there's an option for find care. There's a search tool that allows you to put in licensed professional counselors or independent social workers or therapists, and it will begin to pull up those resources that are in our network that you can start to explore. And sometimes it pulls whole practices, like sometimes there can be groups of therapists in a practice, or it will pull individual providers up as well. Beyond that, certainly there are resources, out in the community, different websites. Psychology Today has a great website that has a therapist finder. Be very specific about, licensed professional counselor, licensed independent social worker, or use terms like counselor or therapist, or it's going to pull up providers that may be more than what you need, or maybe not have. It becomes a little frustrating if you're calling expecting to get one service and the provider says, well, that's not exactly what I do. Being specific with your search terms, I think, can be really, really helpful.
I want to thank Dr. Brian Fox for joining us. This conversation of mental health and getting care is so incredibly important. We hope this discussion can help you or someone you know. Blue Cross Blue Shield of South Carolina members can call the number on the back of their insurance card for mental health resources. We hope you join us again for our next Ask a Therapist discussion.